Hi, welcome to Chapter 11. Hope you like my Mario Brothers introduction. Maybe some of you played the game. Don't know, but I thought I'd take a shot. Chapter 11, we're going to talk about students with low vision and blindness. And it's going to be really important for you to understand how you can better accommodate these students in your classroom. As always, let's start out with, what does IDEA have to say about this? How do they define students with visual impairments? Well, they look at a vision impairment, which includes blindness. It means an impairment in vision that even with correction is going to adversely affect a child's educational performance in your classroom. Remember, this term also includes partial sight and blindness. So let's look at the normal visual process. We see the light rays entering the cornea, then the iris responds to the intensity of the light. This light passes through the pupil to the lens. Then this lens focuses on light rays that goes into the retina, and the retina sends the signals along the optical nerve into the brain. Is this going to help you be a better teacher for your students? Probably not. But let's just take a quick look at an animated video showing you exactly how the eye works, because this will come into play when we talk about the different types of visual impairments later in this presentation.
The location of the eyes enables us to see length, width, depth, and distance of an object. The eye has three layers: the sclera, choroid, and retina. The sclera is the outer white layer that maintains the shape of the eye. Muscles attached to the sclera control eye movements. Choroid is the middle layer that contains the blood vessels. The cornea is a clear circular area in the sclera where light enters the eye. The pupil is the circular opening in the front of the choroid. The iris is the colored smooth muscle surrounding the pupil, which adjusts the size of the opening according to the brightness of light. The lens is located behind the pupil and between the anterior and posterior chambers. The lens is a transparent, flexible biconvex structure that bends or refracts light rays, so they focus on the nerve cells of the retina. The chambers are filled with a watery fluid that gives shape to the eye and helps refract the light rays. The anterior fluid is called the aqueous humor, and the posterior fluid is called the vitreous humor. The retina is the inner layer and contains the nerve cells, the rods and cones, and the bipolar cells. Rods are sensitive to light but do not sense color. Cones sense color. The highest concentration of cones is in the fovea centralis. The rods and cones synapse with bipolar cells, which then synapse with the ganglia cells whose axons form the optic nerve. Light rays enter the eye through the cornea, pupil, and lens, where the light rays are bent or refracted to focus them on the rods and cones, which transmit the stimulus to the optic nerve and then to the occipital lobe of the brain for interpretation.
All right, hope that animation helped you understand a little bit better on how the eye works, but let's talk about the types of vision loss related to our students in the classroom. The two types, one is visual acuity, and visual acuity is measured by the 20/20/2200 scale. I'll talk about the Snellen chart in a little bit, but that's one type of vision loss. The second type is peripheral vision, and this is tunnel or restricted central vision. Due to an injury I suffered as a child, I was involved in a playground accident at age 5. I got hit so hard in the face with a swing, I still have a scar above my eye. My eye was out. My eyes have never really fully recovered. My eyes don't work in tandem. I can't see 3D movies. I have horrible depth perception, but I've learned to make up for it since it happened at such a young age. So when we talk about peripheral vision, this is your vision field. Like how much can you see? Are there blind spots? Things like that. And that could come into play, especially if a student has partial blindness in like a left or right eye, or a central vision issue. So just be aware that there are all different types of vision loss. When it comes to IDEA, they use the term visual impairments, and this is for students with visual disabilities, students with partial sight, or for students with low vision. And they look at 3 factors related to this vision impairment. First of all, what is the actual degree of vision loss? Is it low vision, or is it categorized as blindness? Also, what age did the student lose their sight or begin to have vision issues, the age of onset? Did this happen from birth, or did this happen later on in life? And then they look at the type of loss. And you could look at this related to the animated video you just watched. Is it a condition of the eye? Is it a condition of eye muscles? And I can speak to that because I've had my eye muscles worked on 2 times through surgery, and let me tell you, getting stitches in your eyeball is nothing but a great time. Conditions of the cornea, iris, and lens. Is it a condition related to the optic nerve, or is it related to the retina? These are all going to have different types of interventions medically, but in general, you're going to have to know the type of vision loss your student has in the classroom so you can make better accommodations and modify your classroom to meet their mobility needs. All right, what are some of the characteristics of this population? Students who are blind and do not have any functional use of sight are readers of Braille. They're going to need orientation and mobility training. We'll get to that in a little bit. They're also going to need help with social skills. Remember, individuals who can't see our verbal cues, hand gestures, facial expressions, they're going to be significantly behind their same age peers when it comes to social skills, because think of how many signals and how much information we get from our vision. Our students are going to need some additional help learning to function, learning to communicate. Students with low vision are readers of standard print, and the vast majority learn to read and write. They just learn to function in society through technological adaptations we'll talk about later on in the chapter. They're readers of enlarged print. If you check out any of your computers, you can find out there are a lot of accessibility options that are basically mainstream. You can make your icons very large on the screen. You can make the screen appear much larger. If you look on any Windows program, they also have what's called a magnifying program that'll allow you to look at a small portion of the screen in a much larger window for further analysis if there are vision issues. At the end of this video session, I've also included a neat little video I came across on how to read Braille. It's only a 7-minute video, but I found it extremely interesting on how the Braille process works. And it was a lot simpler than I thought it would be. So give it a shot. Check it out at the end of the video. All right, how prevalent is this condition? Well, according to the American Federation of Blindness, approximately 1.3 million Americans are legally blind, with 10 million with low vision or blindness. Worldwide, only 4% of all blind people are children. Visual disabilities increase with age. And no, I'm not at that level yet, but I'm inching towards it. And the incidence of visual disabilities in children has greatly decreased because we've gotten much better at early intervention. There's been a lot of medical breakthroughs and reduction of infectious diseases through vaccinations. But nearly 2/3 of all children with visual disabilities have more than one. So let me just start by saying many of these students will have multiple disabilities, which we will talk about in chapter 13. It will be very rare for you to have a child in your classroom where their only impairment is visual. There are schools still specifically designed for schools for the blind to teach the critical skills they're going to need to develop, and there's experts there to help them along the way. With this population, The least restrictive environment may be a separate school that focuses on orientation and mobility, teaching them to use a cane. And I'll have a video for you in a minute on that one. But let's check it out. Yep, 39 million people worldwide are classified as being blind. So this is a significant factor for many individuals, and it'll just be learning how to accommodate them in your classroom, and I'll give you some tips a little later. So what are the causes? Well, some numbers have, some substantial numbers of children have genetic causes for their visual disability. Medical technology can now correct or lessen the impact of a visual disability. That's why we're seeing decreasing numbers. I'm sure many of you out there have already had LASIK surgery. I know many of my family members have, and it's greatly improved their vision. Now they don't have to use contacts, glasses, whatever. They can, get rid of all the Bausch and Lomb stuff. However, medical technology contributes to the number of visual disabilities increasing because there's the survival rate of premature babies and those with multiple disabilities. So it's a give and take. We're saving a lot of lives, but sometimes these children can have additional disabilities due to any type of trauma they may have suffered. So how can we prevent visual disabilities? Well, many can be prevented through early and consistent treatment, lots of safety measures, avoiding eye injuries, and having good access to health care. So how can we overcome some of these challenges? Technology can be a very powerful guide in this process. Computers can provide access to printed information. I'm going to show you a technology video in just a moment where you can start seeing how a program such as JAWS can actually read the screen for individuals with visual impairments and make an auditory recording of anything that's on the internet. If you want to check this out, next time you're on any website, lightly scroll over with your mouse on a picture and you will notice that a description of that picture eventually shows up. This is an accommodation for individuals with visual impairments. Their programs will pick that up and describe the picture that's on the page for them. We know that we have visual input devices. This is equipment that can increase print size on closed caption TVs, audio input devices, and tactile input devices that allow people to use and gain information through touch. Let's look at a video that explains technology used by individuals with vision problems.
Whether you are a low vision student, blind student, or someone who struggles to read printed material, a scanning/reading program might be your answer. This program allows you to scan a document and have it read back to you, ignoring any images on the page. This software reads to you while displaying the printed document on the screen.
Noodles, butter, cheese for cheese blend.
You can edit this material, use notes, bookmarks, text markers, and trailers to follow along with the text. It gives your student up-to-date, now access to the daily newspaper, magazine, or handout without waiting for a reader or for it to be brailled. This software is a definite tool for any student's independence.
So there is a lot of interesting technology out there to assist students with vision problems, but let's check out assessment. When it comes to assessment, early identification is key. Photo screening is a system of testing used for acuity for those who cannot participate in visual assessments, but we screen infants as much as we can early so we can intervene and come up with the appropriate accommodations for them. When it comes to pre-referral assessment, vision screenings in most states require visual screening for children. You may recognize this. It's the Snellen chart. I think you've all had some experience with it. Here's another one I think you might kind of like. Let's see. You are kind to Dr. Daviso. He's cool. Probably haven't seen that chart. Just some little fun one I found on the internet. You never know what you can go and find technology-wise when you go surfing the web. That's not an official Snellen chart, by the way. That's like an official Daviso chart. So further, when it comes to assessments, identifications are done through ophthalmologists, optometrists, and opticians. The evaluation also requires students with visual impairments will require accommodations during instruction and during assessments. I will show you a little bit on how they do vision tests with children a little later in this presentation. So when it comes to early intervention, effective preschool programs should promote the following: basic communication and interaction patterns, teaching those critical social skills. It also should focus on a fair amount of play, so students get a chance to interact with their environment, interact with same age peers, and learn to communicate with others. And this is critical because students who are blind or have low vision are 2 years behind their sighted peers when it comes to play skills. So the more opportunities, the better. Let's check out this next video. It's way cute. It's a video of an example of an early intervention and teaching a young child to use a cane for mobility.
Tap, tap, tap. Slide, 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 slide your cane. Slide, slide, slide your cane. Good job. Who, Laura? She'll be here in a little bit. You know that this is the last time you usually have me, then you go home to Laura, huh? Mm-hmm. Slide, slide, slide your cane. Side to side. Side to side. Can I see you slide it side to side? There you go. Side to side. Side to side. Good job. Side to side. Ooh, hey, there's the wall. Pay attention. There you go. Good job. Good job. Side to side. Oh, I love it. Good job. Good job. Are you video any of this? Are you videoing already? Oh, cool. Side. Oh, great. You can hear me singing on it too, huh? Side to side. Side to side. All right, can you turn left? Good girl. Come to me. This way. Left. 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 There you go. Straight. No, left. This way. That's the cafeteria. Come here. Hannah. Hannah. This way. You hear it? You're listening, aren't you? Come here. Turn left. Come on. Keep going. Let's see if we can find the door. See if you can find the door with your cane. Come on. Can Mr. Cane find the door? He's going to look for it. Come on. Let's go outside. What are you listening to? Come on. Let's go outside. I know you're listening to that. I wish I could tell you what that is. I don't know what it is myself. I hear something humming in there. All right, find that door. All right, ready? 1, 2, 3, push. Push. Help me push. Good. Find the map. Good. Yeah, I know you don't like to walk on the map for some reason. All right, find the next door. Good. We're going to push. See where it's going to open. There you go. Over the threshold, out the door.
After I watch that video, I just have it in my head, side to side, side to side. How cute was that? These are critical skills kids are going to need early on so they can be as independent as possible. But when it comes to early intervention, exemplary preschools are highly structured. They have secure atmospheres to make the kids feel safe. They include many opportunities for play. They're going to be a little bit more informal and more home-like. They're going to have a broad instructional opportunities for students to learn and interact with their environment. And it's going to include peers without disabilities, and it's going to include family support. Let's check out an example of a program for students that are involved in an early intervention program for individuals with visual impairments.
Around 7 weeks, I started noticing that he would not follow any objects in front of him. I saw that his eyes started shaking, so I decided to take him to his pediatrician, and he saw the shaking that I saw in the eyes, and he saw that he didn't follow. He recommended us to an ophthalmologist. The ophthalmologist confirmed that he had bilateral retinal detachments at 7 weeks old. He had his first surgery at 8 weeks old in Miami.
You know, I like sports. And all my kids, you know, they play sport, my older kids. So I was, you know, we're going to play sports. We're going to play football, baseball. When I find out, it broke my heart.
Sean was born on March 11th of 2010. He's 13 months old. And Sean was actually born with albinism, which is a inherited genetic condition which results in limited melanin pigment in the skin, hair, and the eyes. The major thing I think that we noticed was there just wasn't really an engagement, a lack of direct eye contact from a young age, and I think it was one thing right at birth, but as he started getting a little bit older, as we got closer to that 4-month time point when he was actually diagnosed, that's when we really noticed that something may not have been right.
Grace was born about 6 weeks early, and we knew that in utero, we knew that Grace had not fully developed hands or feet, and so when she was born, we expected that, but when she was 4 days old, we found out that she had underdeveloped and cystic kidneys and was actually in stage 4 renal failure. Her nephrologist told us that she had a 50-50 chance to live to her first birthday.
What you did to it?
Then at 6 weeks old, we had a visit with Dr. Blumenfeld and found out that Grace was very nearsighted, that in fact she had inherited my vision, which was the one thing we could have possibly expected, kind of the, you know, one more thing that was going on at her life then. And I think at 10 weeks old we found out that she also had congenital nystagmus, which I have as well.
Good girl.
Kylie was born at 24 weeks gestation, so basically her due date was October 1st and she was born mid-June. She was 1.5 pounds when she was born, and she was a twin. Her twin survived 8 days, and then we lost her because her lungs just weren't strong enough. Kylie had her first surgery when she was 3 days old, and then when she was 7 days old, she had a brain bleed on her head. About halfway through her NICU stay, she developed what they call retinopathy of prematurity. Basically what that is the blood vessels around her retina formed abnormally, and if that happens, the retina can end up detaching and it can cause blindness. So she ended up having laser surgery for that and to resolve that.
Lighthouse's early intervention program serves children birth to 5 years old, and the only qualification is they have to have a severe vision impairment or blindness. One of the first ways that parents bond with their children is mommy holding the baby when they're being fed, or daddy giving the baby a bath, and that eye contact and all the silly noises that you make and the games that you play. And one of the first things that a lot of our families say to us is, I don't even know if my baby sees me.
In the NICU, we take care of sick babies. Some of them are premature, some of them have other problems that land them here. I'm one of a large group of neonatologists based here, and we take care of about 1,600 babies a year. We need somebody like Lighthouse who understands what the resources are, who understands the specific needs of their patients, and can move them along that path to really success.
As a parent, that's the whole crux of the issue, right, is the fear of the unknown. And so you get this diagnosis and you just don't really have any sense as to what this means in the long term. It's interesting, in just the year or so since he's been diagnosed, what a different perspective we have on it now, but we just weren't aware of any other children or adults. As we become more included and more aware, the community of folks who live with low vision or blindness, I think we have so much more hope for Sean. But in the beginning, it was just a scary diagnosis because you didn't know what you didn't know. On paper, Lighthouse Early Intervention is here to work with Sean, right? And yet, I feel like I've benefited tremendously.
Well, I think that it's just great education for me too, to watch the things that Susan's doing with Grace, to see the games and just the little activities.
Thank you. I truly believe that with Lighthouse, with them looking at the whole child, and they followed her cues. They didn't just come in with a plan and this is what we're going to do today and then that's it. Where some of our other therapists did that, and there was never a time when Kylie didn't enjoy having her therapist come to the house from Lighthouse.
It was really interesting because Susan was just watching. She had a toy, a ball for tracking, that Grace decided to start kicking. Susan said, well, okay, I kind of like the foot-eye coordination that I'm seeing, so we'll let her go ahead and continue that. And then I said, well, that actually ties in really well to a physical therapy thing that she needs to be doing, standing on one foot, shifting her weight over and kicking. So it's kind of neat to see how it can all incorporate together.
It's very critical to get these children at an early age, to get them hopefully within that first year of life, but if not within the first couple of years of life, to be able to have a year or 2 years or 3 years to work with them before they turn age 5. So much is determined before a child turns age 5, and it sets the groundwork for all future learning that comes after that. We are contracted with the Division of Blind Services to serve 64 children per year. We currently, at this point of the year, are serving 69, and I have another 7 children who have been referred who I haven't been able to assign to a caseload as yet. All of the sources of funding that we've had in the past have experienced cuts. Some of them are still there, but they're there in smaller amounts, and the cost of serving the children hasn't gone away. It's still there at the same rate or higher, and so it's just become extremely challenging to be able to find the dollars to serve the children.
If there was no Lighthouse in Central Florida, really our patients would be left wondering where they could go, and frankly I'd have a hard time directing them.
There's a tremendous number of people that have visual loss, and maybe we didn't realize that until we had Sean and we found out about Sean's condition, but now that we're so much more educated and we've met a lot of other families, you really do, it's comforting to know that you're not alone. But also it's scary in that there's a tremendous amount of people that would be without support and services if funding didn't continue.
I know that Kylie would not be where she is today had it not been for our mentor. And I know that she has come so far because of this program. And I know that the mentors believe so highly in the program and in what they do.
Francisco is currently in a, very proud to say, kindergarten general ed classroom. He's no longer in an ESC program. The Lighthouse of Central Florida guided me to deal with the school systems and how to advocate for Francisco. And so nevertheless, in his kindergarten year, he's got all these resources and he's doing amazing. He's doing great.
The Lighthouse of Central Florida definitely saved Francisco's life.
Just in that 5-6 month period since we've been working with Lighthouse, I mean, just to see Sean's level of engagement and how much more dramatically engaged he is with us and other people around is really quite comforting, and it gives us a lot of excitement as far as where Sean will be in the future.
Man, what a great feeling that your child doesn't have to feel that they are unsuccessful or that they can't do anything, because Grace will face many challenges in her life. And I want her to always know that she can overcome anything she wants to, and that she will be able to achieve, and that there are services out there like Lighthouse of Central Florida that are going to help that happen.
All right, I hope you found that video of that early intervention program helpful, but let's look at teaching students that have a vision loss. The majority of these students, 57% of them, spend the majority of their time, over 80%, in the general education classroom. When it comes to curriculum, these targets should include life skills, skills for independence, literacy, learning to read, and orientation and mobility. When it comes to methods of reading and writing, these include but are not limited to the use of Braille, the use of enlarged print, and print-to-voice translations. Technology has come a long way when it comes to voice-to-print technology. It's gotten much better at voice recognition. The processing systems have become much more attuned to working with individuals and making sure their voices are heard. Technology just always tends to astound me. It has such potential for individuals with disabilities. So how can you make instructional accommodations in your classroom to better serve these students? Remember, every individual is going to have different needs and will require different accommodations. But in general, you should modify and really analyze the language you use. Rather than just saying, where's the text? Oh, it's over there. No, you want to talk about the large book is on the counter at the corner of the art table. If your students are spatially aware, if they have been trained to be mobile in your classroom, they're going to be able to follow your directions much more clearly and accurately. So make sure you give them explicit directions so they know exactly what's expected of them. They're going to need some extended time. They may also need a reduction or a change in the assignment. Maybe it'll be an oral report versus a written report. And they may use a computer in and out of class for work. Let's look at a video that can give us some perspective on the needs of individuals with visual impairments for somebody who really knows what they're talking about. Check this out.
Hi, I'm Heather Nyblade. I've been blind since birth and have had to deal with people who are unsure of how to interact around me. Today I'm going to talk to you about some important tips to remember when being around people who are blind or visually impaired. First, I'd like to discuss how to treat and interact around someone who's blind or has low vision. People who aren't sighted have the same feelings and capabilities as everybody else. Being talked about behind their back is one thing that happens to people who are blind, and it hurts them as much as it does to someone who can see. When somebody speaks for me, it makes me feel like they're not realizing I'm capable of self-advocating for myself. I've had experience of being a DJ for 4 years. In April of 2009, I was a DJ for a Braille workshop that was hosted by the National Federation for the Blind. I was also a guest DJ on Hey Mom, I'm on 91X in 2006. That was with Steve West, the DJ who did the Sunday morning show. I'd also like to talk about when to help and when not to help them. If I had a can of soda in front of me and someone says, "Do you need help?" I'll say, "No thanks, I can do it myself." If you see a person who's blind and you want to know if they need assistance, ask them. The third important thing when dealing with people who are visually impaired is to accept them. When people meet someone who's blind, the first thing they might think is, "Oh, you poor thing, are you alright?" I'll explain to them I'm fine and capable of doing lots of things that don't require vision. Now let me talk to you about following the rules of the road. When a person who's blind is waiting to cross the street, a pedestrian or driver might wave at them thinking the person who's waiting can see them doing it. Well, unfortunately, they can't. There are two ways for someone with a visual impairment to know when it's safe to cross. The first one is when they don't hear any cars coming, which is called an all quiet. The second one is an all clear, which means there's a car coming but not toward them. They'll hear it in the distance. Have you ever wondered how a person who's blind needs help traveling around a school campus? Well, there is a solution. I use a cane, which is a tool designed to help me travel independently. If I end up hitting you with it, that's my way of figuring out what's around me. If there's an object in my way, such as a trash can, the cane will hit it. When I'm traveling around campus, there may be times when another student or teacher will stop and talk to me. It's important to avoid socializing with me when I'm on a route because I might end up getting off task. When I'm going toward a door, it's helpful to me when someone will ask if I need assistance if they're standing nearby. If they choose to offer assistance, I may not recognize when the door is open, which causes me not to move forward. Remember to let me know when the door is open so I'll be able to go inside the building. This helps especially when there's a lot of noise around me. Some adults who are blind will often consider getting a guide dog. A guide dog is trained to assist a traveler who's blind be successful in the community. When the adult is a first-time student, they are required to participate in a 1-month training program where they'll learn when to give the commands. They'll also learn how to do daily chores for their new companions, such as grooming, feeding, and walking. Touching a guide dog when their harness is on isn't necessary. The harness is an indication to let people know the dog's working and shouldn't be distracted. But when their harness is off, it means they're off duty and has free time. When a person who's blind applies for a job, the employer might not understand the things they can do independently. Or during a job interview, they might ask a question like, "How can you read if you're blind?" The answer to that is, "My fingers are my eyes to help me read Braille, a system of raised dots." A resume is a great piece of evidence to prove to the employer that people who are blind are capable of doing lots of things, such as taking a message for a phone call. I use adaptive technology that'll help me with doing easy tasks and be successful in getting the job done. One of the pieces of equipment I use is a Braille note, which is like a laptop. It'll allow me to create Word documents, use my GPS to know where I'm traveling, and print out what I wrote for people who can see. Apple has created a screen reader called VoiceOver, and they've added it to the iPhone 3GS.
Mail, mailboxes, button. Compose, button. Compose, 2, text field, is shift, capital P.
This will allow me to navigate to different items on the touchscreen without asking for assistance. I'm Heather Nyblade, and I hope you've enjoyed learning some new things about people with visual impairments.
All right, when it comes to instructional accommodations, I want to make sure regardless of whatever accommodations you're providing to students, whether they have visual impairments or any disability, you should keep your expectations high. We want our students to learn. Once again, we're looking at universal design for learning. Our classroom setting should be welcoming to our students. If you have students with visual impairments in your classroom, it's going to be important for you as a member of a team to realize you can design your classroom to make it easier for them to find the door, to find the teacher's desk. You could learn to structure tables so they can pass their hand on the edge of a table and knowing that it's going to guide them to the entrance of the classroom. Or the edge of their desk, if they follow it with their hand, is going to lead them straight to the teacher's desk. You might even want to rearrange your room to have certain areas that are carpeted that are always going to be free of barriers. This will help your students quickly acclimate to the surroundings in your classroom. So once again, keeping that barrier-free environment and making your class universally welcoming to all students. When it comes to transition to adult life for this population, they face a number of biases and discrimination that create barriers to employment. even when compared to students with other disabilities. As a group, students that are visually impaired tend to be underemployed due to discrimination and a lack of high level of literacy, a lack of social interaction skills, and the inability to self-advocate for themselves. That's why it's going to be so critical for you, if you have students like this in your classroom, to work with them on social skills, work with them on being able to ask for help, setting goals, being self-determined. Many adults with vision impairments feel that their access to recreation and leisure activities is pretty much limited. We're trying to do much better. If you look back at some of the other videos that focus on adapted physical education, these are things that are going to take time. They're going to need to work at it. You're going to need to work with team members to get them involved in these activities. More events are becoming accessible because of laws and changes in attitudes due to the Americans with Disabilities Act, but we still have a significant way to go. And pre-college admission programs can make the chances of high school graduation much higher. If we have high expectations for our students and expect more from them, we're going to get it. If we expect less out of them and have low expectations, that's where they're going to meet. I cannot stress it enough. Keep your classroom expectations high for all students, and eventually they will get there. When it comes to transition to work, despite high graduation rates from high school and college, adults with visual impairments still struggle to find and retain employment. To battle this issue, recommendations to high school level teaching include getting them employed in the community as soon as possible. Let them do internships in real world settings. Get them ready. They should be very familiar with the environment they expect to participate in after they leave school. So that's going to have to include community participation. Getting them to graduate through college. Making sure the Office of Accessibility on this campus keeps expectations high, keeps services high to make sure students are getting all they can out of their education. Education of potential employers so they know exactly what to expect from this population, knowing that they actually can be very, very productive members of society and be independent. And also, this includes informing potential employers of programs that will help pay for equipment. There are a lot of programs out there that can help make the accommodations needed on the job so they could have good, competent, and reliable workers. When it comes to collaboration for this population, once again, you're going back to that team approach. Collaborative services from visual disability experts should be present in your room. You should be going out and seeking out experts who can specialize in helping students with visual impairments. Teachers of students with visual impairments can help general educators structure their learning and physical environment to the benefit of all students. When it comes to accessing the community, many still express frustration with accessing recreation and leisure activities. Some advances with this issue include more tactile exhibits in museums, more access for guide dogs, and freeze frames of plays where things are actually described to them. And we've gotten much better in society allowing service animals, but we still have a long way to go. One area I know I've seen students face barriers. If they use a guide dog, they're not going to be able to work in any type of, I guess you would call it, kitchen environment. There's still other health codes that supersede the needs of others. So just be aware, if you're going to be working with this population, you'll become an expert in it in no time. But one of the people you're going to be collaborating with most when it comes to service providers is what we call the Orientation and Mobility Specialists, the O&M. They can teach students the necessary skills to help navigate the community and your classroom independently. Here's an informational video explaining the role of the Orientation and Mobility Specialist.
Are there any names or acronyms for your discipline?
Orientation and mobility specialists are sometimes referred to as O&M specialists. Also, they're referred to as O&M instructors or mobility instructors. Something that you commonly see after someone's name is COAMS, which is an acronym that stands for Certified Orientation and Mobility Specialist.
What is orientation and mobility, and what kinds of services do you offer a student who is deaf-blind?
Orientation and mobility is about life skills for people who are visually impaired. It addresses independent movement, independent travel in a variety of environments. Orientation and mobility emphasizes the use of the residual senses, and it applies techniques and strategies and tools to help a person become as independent as they can be and to travel with as much safety, efficiency, and gracefulness as is possible. One of the more well-known tools of orientation and mobility is the long cane, which can provide a student with protection and an exploration tool to reach out into the environment. Orientation and mobility specialists also promote the use of vision whenever there is residual vision to be used. We offer a tool such as a monocular, which is a distance vision aid for seeing things in the distance within the community. Activities of daily living are a very big part of orientation and mobility. And this also ties into vocational skills, pre-vocational skills. Learning how to care for oneself and do things for oneself really is a pre-vocational skill. And in order to be as independent as one can be, you really need to have the ability to ask others for help when there's a visual impairment. There will always be situations in one's life when they have a visual impairment in which they need to ask for assistance. In connection with that, something that I think is very important for students who are deaf-blind is the use of social skills and communication skills within the community. I think that one of the great benefits of orientation and mobility for a student who's deaf-blind is the multitude of experiences that are offered within the community to practice these social skills and interactions with people other than whoever it is that they're the most used to being with.
Is there a difference between what you were trained to do and what you actually do for students who are deaf-blind?
I think that the orientation and mobility program that I went through prepared me well for working with students who are deaf-blind, because they left us with the message that you need to look at the individual. You need to look at where that individual is functioning and go from there. One of the things that I was not prepared for, based on my education, was sign language. Sign language is not something that's included in the teacher training program for orientation and mobility specialists. Another thing that is not included, unless you are duly certified as orientation and mobility and teacher of the visually impaired, is Braille. So those are two things that, in my experience, I have used that were not part of my training.
What does an orientation and mobility specialist bring to a student's educational team?
Orientation and mobility specialists can contribute a variety of things to the educational team. One of those things is a knowledge of how different visual diagnoses impact a person's functioning and their independent travel abilities. Also, the fact that we've had experience in teaching and learning the skills associated with independent travel. We bring an understanding of how the skills are built upon each other so that a person can travel confidently and independently. Because there is such diversity among students who are deaf-blind, the way in which orientation and mobility services are provided can vary. Sometimes Services are offered on a consultation basis and other times on a direct service basis. It really depends on the unique needs of the individual. Orientation and mobility services vary somewhat depending on the age of the child, but the primary difference has to do with the environment that you teach in. More often, the student who's an infant or a preschooler is being served either in the home or in some kind of a center. And as time goes by, we tend to be moving out into the community more. Perhaps the student's yard would be the next instructional classroom area, and then we move into the community.
How do you communicate with other team members, and why is this so important?
Communication between members of the educational team is very important. If activities and goals that are being worked on in mobility are not discussed or shared with others, then there would be no reinforcement of these activities by family members and other team members. So much more progress is noticed when everybody is doing the same types of things with the student. I like to make home visits as a regular part of my instruction, because I find that particularly with students who are deaf-blind, because they have unique communication issues, that it's really, really important for me to be able to reinforce things that matter to that student. So by becoming familiar with what goes on in the student's home, who the members of the family are, what does the student like to talk about at home, it really makes my job more interesting and more meaningful, and there's more progress seen with a student. One way that I like to communicate with families is by leaving messages regularly. Cell phones and email are very helpful. But it's also important to model what it is that's being done, because specific orientation and mobility skills need to be shown in person. So I like to invite families and paraeducators and teachers to go into the community on mobility lessons. It can be really fun because it's a social event usually, and the student really enjoys that, having all their teachers or family and teachers together at the same time.
Are there any misconceptions about your discipline you would like to clarify?
Orientation and mobility is sometimes confused with occupational therapy. Perhaps because they both have an acronym that's 2 letters, O&M, OT, and because orientation and mobility has the word mobility in it, and they've heard occupational therapists refer to mobility from the orthopedic perspective. I think there are misconceptions about what orientation and mobility instructors do. I think that sometimes people see us out following a student or with a student in the community, perhaps making purchases at grocery stores, buying things at restaurants, and I don't think they're really sure or that they really understand that it's a lesson and that there are skills being taught throughout this whole process.
I hope you found that video on the orientation and mobility specialist helpful. However, when it comes to partnerships with families and communities, it's going to be important for you as an educator to help parents with their children's development. And this includes helping parents with communication, helping them teach independent living skills, helping them with mobility, sensory development, fine and gross motor skills, and those critical social skills our kids are going to need. Parents and educators need to develop strong partnerships, whether students have vision impairments, learning disabilities, or no disabilities at all. working together with parents and community members is only going to make you a more powerful and a more effective educator overall. All right, let's review some of the topics from this chapter. First question, Dante is legally blind, so he cannot read from printed material, is eligible to receive federal and state benefits, has no functional use of sight, must have central visual acuity that is less than 2/100 or less when it's corrected. Right. All this means is Dante is eligible to receive federal and state benefits. Let's check out another one. Jonas has formed a mental map or blank of his surroundings. Is it direction? Is it acuity? Is it spatial relations? Or is it orientation? Right, it's orientation. Last one. Which symptom is not a sign of a visual disability? Students that have their eyes watering, seeing a child bump into things, seeing a child rubbing their eyes, or a child that talks loudly. I don't even think you needed to go to the text to figure this one out. Yeah, if a child just talks loudly, that might be more prevalent for what disability? Right, hearing impairments. Okay, if you have any questions regarding anything I covered in this chapter or on the videos, remember just to get a hold of me. The next chapter we'll be focusing on is students that are on the autism spectrum disorder. So until next time, have a good week.
This is Grade 1 Braille in one lesson. Braille is based upon a grid of dots small enough to fit under the tip of your finger. These dots are numbered 1 through 6, and when raised in different combinations, represent different letters, numbers, and punctuation marks. Each Braille character, or cell, can be described by saying which of the dots are raised in that cell. For instance, this is a 1 cell, this is a 2-5 cell, this is a 3-4-6 cell, and this is a 1-2-3-4-5-6 cell, otherwise known as a full cell. Braille is actually very easy to learn. Most of it is based upon the first 10 letters of the alphabet, A through J, and these letters only use the top 4 dots in each cell. Because of the importance of these particular letters, we'll spend just a minute trying to memorize them, and we'll do that with a story. One day you decide you want to cross a river. So you approach a bridge, but it's closed. So you take the detour, but realize you're on empty. So you fill up with fuel, but now you're in gridlock. So you trade your car for a Harley, turn the ignition on, and jump over the river. Each of these words begins with the letters A through J, and each of the symbols represent the raised dots within each letter. Let's go through the story one more time. You approach a bridge, but it's closed. So you take the detour, but realize you're on empty. So you fill up with fuel, but now you're in gridlock. So you trade your car for a Harley, turn the ignition on, and jump over the river. This same pattern of dots used for letters A through J is repeated over and over again in Braille with just a few small changes. If you can remember letters A through J, you've pretty much learned Braille. So let's take away the symbols and add 2 more rows of cells that have the exact same pattern of dots as letters A through J. We'll use the second row to represent letters K through T. And to make these cells different than the first row, we'll also raise dot 3. For letters U through Z, we do the same thing, except we raise both dot 3 and dot 6. For now, we'll discard the rest of the cells on this row, as we won't see them again until we get to Grade 2 Braille. But wait, what about the letter W? Well, Braille was invented by a French teenager, and in classical French, W isn't used. However, it was added as a special character later. For now, we'll simply add it to the end of the 3rd row and put it in its proper place when we come to Grade 2 Braille. We now have all 26 letters of the alphabet in Braille. So let's look at numbers. We have already used 26 out of the possible 64 Braille characters that can be created out of 6 raised dots. So let's reuse letters A through J for numbers 1 through 9 plus 0. But wait a minute, when we read these characters, how do we know if they represent letters or numbers? Well, there's actually a special character that will come before a set of numbers that will let you know that, hey, these next set of characters are actually to be treated as numbers. So let's move over the cells that we have created so far and make room for this special character. And here it is. This basically looks like a backwards L, and you can think of it as turning letters into numbers. Once it's on, it stays on, and all the characters you read after this character are considered numbers. But what if we want to go back to using letters? Well, we just used another special character to turn off the numbers and go back to letters. So what about capitalizing letters? Everything we have seen so far is lowercase. If we want to capitalize something, we just use a very simple Braille character, and it's just the number 6 dot raised. The character that immediately follows this character is considered capitalized. This isn't like with the number symbol, where once it's on, it stays on. The capitalized character only works for the very next character. So now we have our letters and numbers, but no punctuation marks. In Grade 1 Braille, these are the only types of characters you will encounter: letters, numbers, and punctuation marks. Grade 2 Braille is meant for more advanced Braille readers and condenses multiple letters or even whole words into a single character. Grade 2 Braille allows Braille books to be shorter than they otherwise would be if they were written entirely in Grade 1 Braille. So to finish up Grade 1 Braille, we will need to look at the cells that represent punctuation marks. Most of the standard punctuation marks can be found along another row of cells that are also a variation on the raised dots in letters A through J. So let's move up the cells that we have looked at so far and make room for this additional row of cells. This time, instead of raising an extra dot to differentiate these cells from letters A through J, we're actually going to move all the raised dots in this row down one position. The punctuation marks on this row don't follow any particular pattern, but they are still fairly easy to memorize. And here they are. Some of these cells represent multiple punctuation marks at the same time, such as the open quote and the question mark. The 5th character doesn't represent a punctuation mark, but we'll keep it in here for consistency's sake. Finally, on the left-hand side is another punctuation mark that doesn't fit the same pattern of raised dots, and that is the decimal point. So now we're looking at all the cells used in Grade 1 Braille. So based upon what we have learned, see if you can tell what word is represented by these cells. Feel free to pause the video if you'd like. So the first 2 cells we know are from letters A through J, because only the top 4 dots are raised. The 3rd cell is from the second row of letters K through T, because dot 3 is also raised. So let's take a sneak peek back to all of our cells again. And as you may have guessed, these are the cells that represent the word cat. Let's try another one. The first 2 cells we know are from letters A through J, because only the top 4 dots are used. The next 2 cells are from letters K through T, because dot 3 is also raised. And the final cell is from letters U through Z, since dot 3 and dot 6 are also raised. So let's take a sneak peek back to all of our cells again. And so if you guessed correctly, then you came up with the word jelly. Our final example is only 3 cells long. The first cell we can tell is different than the others. If you'll remember, when we encounter a cell with a pattern of raised dots that is shaped like a backwards L, it means we are turning letters into numbers. So the next 2 cells are from letters A through J, except we are going to read them as numbers. So let's take a sneak peek back to all of our cells again. And then we'll see that this is actually the series of cells that represent the number 64, which also happens to be the total number of cells used in Braille. And we'll look at the rest of these cells in the video for Grade 2 Braille. But for now you've learned Grade 1 Braille in one lesson.